I love this picture. I did not create this picture. It's courtesy of the website you see there, but it gives patients a good overview of all the symptoms and systems that can be affected by toxic mold. And one day I had a patient say, what doesn't mold do? And that's exactly right. What doesn't it do? So that's why we have to do our due diligence at screening for it, because it overlaps with other conditions. One of the main symptoms that's not on this graph but needs to be discussed is chronic fatigue. We use that term chronic fatigue syndrome, but usually chronic fatigue has an etiology. And Dr. Brewer, he published a paper, Joseph Brewer, years ago on the connection between chronic fatigue syndrome and toxic mold. And that's one of the things I hear from my patients all the time. I am so tired, Dr. Cornish. And then you'll have the patient who has the headaches and light sensitivities and brain fog and kind of like that. I can't find the right words. They may have some vertigo or dizziness. You'll see people who have sinus issues, especially those who have allergies to mold. So shortness of breath and cough and sinus congestion. And then emotional. And that's where I find a lot of patients, because that's when I treat that neuropsychiatric presentation, because people don't think about psychiatric diseases being associated with biotoxin illness, but it is. And I'm going to show you some research to support that, because patients can be agitated and depressed and have mood swings. And then those other musculoskeletal symptoms like aches and pains and strange skin sensations. I had one patient when I first started treating biotoxin illness years ago, who would tell me, I have electric shocks. I feel like static cling, or what that feeling is like. And I'm like, really? But then she moved out of her environment and it went away. And that was like a revelation that these strange skin sensations are true. And I see it all the time. Increased thirst and urination. And that's due to the ADH being affected. So a lot of times you'll have patients who have nocturia, or they have increased thirst. They have also that irritable bowel. So these symptoms kind of tie in with the biotoxin pathway. So other symptoms, a lot of my patients with mycotoxin illness, because it's such an inflammatory toxin, they start having multiple chemical sensitivities where I remember my first patient who had this problem like 10 years ago. She came in my office. I gave her a small amount. I don't know what it was. I think it was like an herbal. And she instantly flushed and was like, had to go to the ER. I'm like, what is that? Then I had another patient. This is the reason why I stopped wearing fragrances to the office, because I would have people that would react. And multiple chemical sensitivity can be exacerbated by numerous conditions that are inflammatory. But this is one of the reasons why in that patient population, you must do the due diligence to determine the trigger, just like with biotoxin illness. And at the same time, those are those patients where you have to treat very, very slowly. And when we review the treatment options for biotoxin illness, and if you ever see that patient in your office that is reacting to everything, it's usually not a side effect. It's usually because they have multiple chemical sensitivity. And as a result, you need to slow down. Electric shocks occurrence, neuropathy, muscle twitches, and temperature irregularity, which is something very common. Dr. Cornish, my husband is hot and I'm cold. I burn the house down and he's hot, and vice versa. So that is also, when you're thinking of a differential diagnosis of symptoms, put some of these things on the radar. Why is it even important that we screen and treat biotoxin illness? Because it makes other conditions worse. As we said earlier, chronic stress leads to chronic disease. Chronic inflammation can lead to a lot of these disorders listed here. And mold toxicity is extremely inflammatory and can exacerbate symptoms like leaky gut, dementia, chronic fatigue syndrome, mast cell activation syndrome, even infections. You'll like evaluate a person for chronic infections. You may treat them and you're like, wait, they're clinically stuck. And it's because that environmental toxin is present. And EMF sensitivity, and then that chronic inflammatory response syndrome.